Staphylococcus aureus, Staphylococcus epidermidis, Staphylococcus coagulans negative, Streptococcus pneumoniae viridans group, Streptococcus pyogenes.
Good evening. This is Ron Burgundy, TV5 News Atlanta. Tonight's top story: Paris Hilton pregnant with alien twins. This just in: an Ebola outbreak in Atlanta. Apparently in 1989, Ebola respirant virus was introduced into quarantine facilities in Virginia, Texas, and Pennsylvania by monkeys imported from the Philippines. Four humans developed antibodies to Ebola respirant virus but did not become ill. 1990, same thing happens again. All the animals were euthanized except for one. He managed to escape and make his way to Georgia, where he was adopted by a kind, dim-witted family in Atlanta. One day the monkey went crazy and attacked the family dogs, who in turn attacked their masters, and that's when all the madness began.
Good morning, doggies! Good morning!
We're here with Dr. Margolis of the DCC, an expert in the field of the epidemiology and prevalence of Ebola. Doctor, what can you tell us about this disease?
Well, the Ebola virus originated in the Dominican Republic of the Congo. It's actually such a lethal virus that it wipes out everyone who is susceptible before it can spread extensively. It has been an endemic in wild monkeys, and the threat is that it can be transmitted from monkeys to humans, and then again from humans to humans. Knowing how it jumps from animal to humans is a crucial part in preventing this outbreak.
And what about the prevalence?
Well, the natural reservoir is still unknown. According to the DCC, the first outbreak occurred in 1976. It affected 318 people. Since then, there's been 10 outbreaks worldwide, the largest being in Sudan in 2000, in which 425 people were infected, and only 53% of those, as many as 53% of those died.
And what about risk factors?
Well, travel or work in areas where Ebola outbreaks occurred, such as the Dominican Republic of Congo and Sudan, are obviously risky.
Are you feeling okay, Doctor?
I'm fine.
Please continue. You don't look okay. Are you able to finish your report?
Yes, I'm fine. Animal research. I'm dying.
Ron Burgundy, Channel 5 News, Atlanta, on scene live with Catherine Donovan, a DCC nurse, here to tell us about symptoms that Ebola patients experience.
Hi, Ron. As you know, the Ebola virus is extremely contagious, and as you may have heard, it's breaking out all over the place here. And just in case you're wondering how you contract it, it's usually contracted by touching infected animals, especially monkeys who may have it, touching patients who may have, human patients who may have the virus, deceased patients. It's easily contracted by just coming in contact with it. It can also be airborne. There are special ways to take care of a deceased person should you come in contact with them. If you do happen to know of somebody who may have the virus, you can look for signs and symptoms like basic flu-like symptoms, headaches, joint pain, fevers, nausea, vomiting, diarrhea, but especially you can look for a late sign of bleeding. And these people, it's called a hemorrhagic fever because these people will bleed from their eyes, from their nose, from their mouth. And you really need to be careful if you come across somebody like that, or even an animal who may be presenting like this, and stay away from them and do not touch them. If you are somebody who is in the healthcare field and you do have to touch these people, you need to take standard precautions. And by this I mean wearing gloves, wearing a mask, wearing a hat, wearing a gown. And if you're in an area, especially some areas of Africa where you may not have access to things like this, then it's easy to make a gown like this, like I'm wearing here. The CDC actually recommends that you just cut open a trash bag and use that. You can also use plastic bags for your feet, just anything to keep you from coming in contact with this blood that is so contagious. Ron, back to you.
You've got a little... Oh, is that what I think? Cut!
Lena.
Oh, guys, I'm sorry.
Studying micro.
Oh, I had the weirdest dream. And you were in it. And you were in it. And you were in it. There was an Ebola outbreak in Atlanta. And you died.
I don't know that that's very possible. I was just taking notes on Ebola. It's a zoonotic virus, and let's see what else I have about it. It's a filovirus. It causes a viral hemorrhagic fever. It's a biosafety level 4 virus, which causes some concern for bioterrorism. They found 4 types of the virus: the Ebola Zaire, Ebola Sudan, and the Ebola Reston, and Ebola Thai. Risk factors, well, being in PA school, we certainly haven't had any vacations, so I haven't been to any endemic areas like Africa. I haven't taken care of anybody that's been sick or died of Ebola. There hasn't been any outbreaks in the U.S. And there's a few people that tested positive for the antibodies after the Reston outbreak, but nobody's actually had it here in the U.S. So I think I'm kind of in the clear. Does anybody else have any notes on it?
Do they have a vaccine for that? I mean, I don't want to get it.
You know, I did read that they were working on a vaccine. It's in clinical trials right now for it to be used on humans. But I think they started that in 2006, so...
Here come your dogs.
I don't have dogs!
So then, what do you think we need to know for the test on Ebola? Well, I would think that some of the most important things are that it's a filovirus and that it's a bloodborne pathogen, so you have to come in contact with blood or body fluids.
Yeah, also, the incubation period is 2 to 21 days. It presents like the flu, and to get a travel history.
And then the third thing, I guess, would be that you'd have to fever monitor for 21 days, do supportive care for anyone, if someone is infected with it, and fluid resuscitation, and I guess that's all they can do.
Yeah. Study up.